Welcome back to my channel. I know this video is going to be one of my longer videos because I know the clock app got you guys in a chokehold and you guys can't sit for 30 minutes, but you're not here to be entertained. You're here to get foundations. So grab a pen, paper, take notes. Again, my name is Lourdes Dorvalis. I am the founder of NCMHE Bible Prep and Social Catharsis. So today we're going to learn about counseling skills and interventions for the NCMHCE test. Think of this as a crash course to counseling skills and attributes. Okay, so I'm going to just walk you through counseling techniques. I'm going to give you clear explanations and practical examples to help you when you become a practicing clinician. All right, so when you think about counseling skills and interventions, this is the part of the ACA counseling test that tells you, and even your counseling when you decide to do therapy after you become licensed, where you have to match your counseling approach to the specific needs of clients. So you have to pay attention to their developmental level, and you also have to pay attention to the current stage they are at in their lives. So you have to develop an individualized treatment plan for your client. This is not where you do a one size fit all approach. It doesn't work that way. Different clients have different needs. For example, when you're providing therapy to a child, you can engage them with stories, games, or drawing versus if you are counseling a senior citizen and they're at the end of their life, you may want to help them with remnants therapies or existential therapy to help them look or gain meaning from their life. So you have to match your counseling approach to fit your client's specific needs. In addition to that, you must also match your interventions to the counseling modality. So if you have a client that comes in for individual therapy and they're dealing with, I guess, substance abuse, and you give them the psychoeducation to kind of help them, it's okay to refer them to group counseling because your client and other individuals have shared experiences and they can relate to each other and learn coping strategies. Think Alcohol Anonymous, for example. Also, if you are doing individual clients, you usually want to individual counseling. You really want to reserve those for individuals who have personality disorders because they require intensive DBT skills training tailored to their specific emotional regulation challenges. Family counseling is when you work with children, always include their family or their parents into the session, not necessarily physically, but into the treatment plan, because that's going to help the children meet their goals when you involve the parent. So the effectiveness of your intervention depends on how you choose techniques that's going to complement your counseling format. What works well for one client or what works well in one setting may need modification for a different individual or a different setting. And remember, you have to address systematic dynamics, not just individual system. And this is where you have to really consider, okay, this client came in for this specific issue. How do I meet them where they are? We cannot stress this enough. You have to build the therapeutic relationship first. This is how you establish trust, maintain boundaries, you show empathy, and you listen deeply. Those are crucial because any rupture at any stage of the therapeutic relationship will cost you as a therapist. Also, when you testing, always choose the answer depending on a question that asks you about the counseling relationship and building trust and developing a rapport. And how you build trust with one client, depending on their diagnosis, will be different. For example, if an individual have general anxiety disorder, it's important to be calm, be a steady present, help them to feel secure enough to explore their worries. Versus someone who has depression, you want to offer consistent encouragement and warmth to help the client combat their negative self perception. So when you use simple statements like that, I'm glad you came today, or you validate their effort, that helps strengthen the connection from the very start. Alongside while building a rapport, you have to facilitate trust with and amongst your clients, because when your clients feel safe and you give them consistent boundaries and you create respectful communication between you and them, this establishes you as honest from the start. And remember, some clients that come to you, and even when you're reading these narratives, they may have reservations about therapy. They don't even know what they need. They don't even know what they want. And because they may not know what they need or know what they want, it is your duty, it is your responsibility to build a rapport and facilitate trust. Also, it's important to note that you have to assist the client with exploring what better means for them specifically. So, doing motivational interviewing techniques like how would your life be if your symptoms improve connects treatment to their personal values and goals, which enhances their internal motivation. So, your goal is to help them build confidence so that they can succeed, avoid arguments with the client. Please, that's really, really important, because when you argue with them, it makes it difficult for them to want to change. They become resistant towards it. And then you help them see the gaps between their current behavior and their personal goal. And always express empathy to your client, understand their perspective without judgment. As a therapist, we always must practice active listening. And active listening looks different depending on the provisional diagnosis or the diagnosis of your client. What you may do for a client that have general anxiety disorder, where you repeat back their worries, you show them that you understand, and you say something like, I see your concern about several things that might go wrong during your presentation. Um, that right there will help them feel heard rather than dismissed. For example, if you're dealing with someone with borderline personality disorder, you have to, it's just so many layers to it. You need to ensure that you listen for the emotion behind their rapid speech. You listen to the contradictory statement to help them get to the core of the feeling. Never get combative with an individual with any type of personality disorder, even any client, period. So for that specific diagnosis, you can say something like, it sounds like underneath all of what you're saying, it sounds like there's anger, there's a fear of being abandoned. That way, when you are actively listening, you're actively engaged, you're focused, and you're responding thoughtfully. You're just not hearing the words, but the meaning and feelings behind them. And this is where you can use your nonverbal cues, like when you're nodding or you maintain appropriate facial expression, eye contact, to show engagement. You give them your full attention. This is not the moment where you're sitting in a session and you're preoccupied with, charting notes or looking at your phone. Active listening also makes or break the therapeutic relationship. Attending skills is what we do as therapists to communicate, again, that we are giving our clients our full attention, which creates a foundation for deeper therapeutic work. So, simple behaviors that we use, like our body language or the annotation or inflection of our voice, can significantly impact how safe and valued a client feels in their session. So, don't go to a session and you're the therapist and you're like folding your arm. No, that shows distance. It doesn't show openness. You have to also reduce distractions in the environment. If you have a client that have a social phobia and, them looking out the window and they're nervous, it's okay to close the window so you can focus on that client so they can feel safe and heard. And then also, when you're dealing with clients that have trauma, speak calm and speak in a measured voice. Avoid triggering them or startling them. Match your pace to their pace. And then make appropriate eye contact because it shows interest without staring. And adapt to the cultural differences and what feel comfortable. Not only that, learn about the cultural differences, but never make yourself seem like you are an expert in their culture, but learn. For example, Asian cultures, they do not like to look at you and make eye contact. So therefore, don't take offense when when you have a client and they're in a session and you feel as if the client is aloof and they're not making the progress you would assume because they're not giving you appropriate eye contact. So, also, when you're dealing with specific clients, notice when their gaze drop, especially during a mental status exam or when they become quiet because it will single increase emotions or feelings that you may need to be aware of. That's how you make sure their affect is linear or is congruent to what it is that they're trying to express. This is a big one. When you reflect content, you help the client feel understood and you give them an opportunity to clarify their thoughts. When you dealing with a client that have general anxiety disorder, you may say, I think you're worried about tomorrow's test because you feel unprepared despite you were studying. You are showing concern and it shows that you are capturing their concern versus when you're dealing with an individual with PTSD or trauma, you reflect their content to validate their experience. Something like it sounds like that memory of that accident brings up intense fear, especially when you hear loud noises like those at the construction site. That alone, when you reflect or validate their experience, that demonstrates the connection between their trauma and their experience. This is tested heavily, and this is reflection of feelings. So, reflection of feelings is identifying the hidden emotion or the unspoken while validating their experience. Sometimes clients may not know what they want, what they need, or what's bothering them, or they may not directly name their feelings, so we must listen to the undertones in their stories and their responses. We must help them name their emotions so that they can develop awareness and the vocabulary for their internal experiences. And when their emotions are accurately reflected, they feel a sense of relief that you, as a client or someone, finally understand their experience. Different diagnoses require different things. What you may say for an individual with depression versus general anxiety disorder is different. For example, you may say with someone with depression as you reflect their feelings, you sound really sad when you talk about not being invited to that gathering. This simple statement helps them recognize their emotions versus general anxiety disorder. You validate their experience by saying something like, that situation sounds really scary for you, especially when you didn't know what would happen next. You are acknowledging them and you are helping them to feel understood than rather judge for their anxiety or their over worry. When you reflect their feelings, you don't need to overcompensate. Your duty is to listen for the hidden and validate their experiences and help them to name what they are experiencing so they can get that developmental awareness. Summarizing is gathering the main points, condensing the information, and you give them a highlighted insight or you emphasize their understanding to help them make connections and you bridge to the next step. So when you are summarizing for your client, you are basically gathering everything, or you giving them a synopsis of what they came to share with you in that specific session. Make sure it's always clear and concise, which captures the essence of what they shared with you. And you collect the most important topics or theme. And then you, after you build rapport, of course, you connect the summary, the synopsis that they shared with you, to future work or homework when it's appropriate. When paraphrasing as a therapist, you listen for the core message. Basically, you're paying attention to the main idea the client is expressing. Even if it takes them a long time to explain or use many examples, you express the same idea in different words, often more concisely than the client's original statement, so they can understand or pull or get the emotional awareness of their lived experience. And then you also ask them if your understanding matches their intended way of their communication to allow them to make corrections. So, how you paraphrase for different clients who meet different diagnosis criteria, you need to ensure that you capture their experiences and you make sure you simplify it for them so that they can know you are attuned and that you are validating their experiences. Validation helps your client feel understood and accepted. It reduces the shame and their defensiveness. This creates safety that allows them to explore their painful experience and consider new perspective. Individuals with personality disorder, like borderline personality disorder, validation is crucial as they often have experienced invalidation when they were children, early on in their developmental stage. And then when you are validating a person, you are acknowledging their thoughts, their feelings, and you're making sense of their given situation and a history. Now, validation doesn't mean to agree with all their conclusion, but it means to recognize your emotional reality. Given what you've been through, it makes perfect sense that you'll feel that way. That right there is a validating statement. When you are acknowledging the importance of the situation, validation counters the client's potential self criticism for whatever it is that they're experiencing or they're going through in that moment. When in doubt, acknowledge their feelings and their thoughts. When you normalize, you're helping your clients understand that their reactions, while difficult, are common in response to their specific situation rather than signs of brokenness or craziness. So, when you normalize their experiences, you're helping to reduce shame and the isolation that they may be feeling. So, when you're dealing with someone with social anxiety or any phobia, you normalize their experience by sharing with them that sometimes we may get nervous in crowds, for example, and when we have to speak in front of others, our brains are wired to be cautious in specific situation because belonging is so important to survival. This right there, the way you explain that scientific concept, depersonalize their fear. They feel like, okay, this is normal. I'm not the only one that it is experiencing that. So that takes away the shame or the isolation that they may be feeling. For example, if you're talking to someone who has PTSD or any trauma related diagnosis, you can say something like flashbacks are actually a common very response when the brain is trying to make sense of a frightening experience. This knowledge that you share with them can reduce sensory shame about symptoms. When in doubt, if you're not validating your client, normalize their experience so that they can be more apt to meet their goals, because it's difficult for when they're already experiencing the weight of their emotions and there is no one that they can share their internal locus with, for them to not realize that some of these things that they may be experiencing relating to their diagnosis is normal. It is in our best interest to provide our clients with education, and psychoeducation is crucial because you are helping them to learn information about their condition. You are introducing them to coping mechanism. You're connecting their mind and their body, and you're normalizing their experiences. You can provide psychoeducational resources via printed materials, recommending reading books, digital resources, or multimedia tools to help them learn about their specific diagnosis and what they are experiencing, to extend beyond your therapy sessions so they can see or make improvements over time. In group counseling, you might want to teach about specific psychoeducation like healthy thinking habits and how to and explaining how negative thought patterns contribute to low mood. When you teach them how to apply those principles across different situation and relationships, it helps the client to meet their treatment goals. Speaking of goals, when you set goals with your clients, you need to start where they are, and you need to make sure it's client directed, and it also show measurable progress, and the goals have to be smart. And when you set goals with your client, you need to also ensure that the goals are collaborative. Not you do the goals, but the client also takes part in it. And the collaborative treatment is done when you gather enough information at intake, and you and the client jointly establish what they hope to achieve through therapy, ensuring that their goals are meaningful to them and realistically attainable. And then you guys discuss the method of selection, which techniques, and you invite the client to give their preferences on about which might work best for them. I had a client that told me, she was like, "Don't give me homework. I'm not going to do homework." I'm like, okay. So I had to come up with goals that it was more tailored to her so that she can be, you know, so she can be able to get a overall picture of her situation to help establish meaning behind it, to make the progress that she was willing to make so that she can celebrate her progress. Um Also, different treatment planning goals. Also, there are different ways to make treatment planning goals for different diagnoses. So, what we do in one session will be different for what you do in another session with someone else. What you do for someone with PTSD will be different than what you do for someone who's struggling with anorexia nervosa. So, keep that in mind. All goals must be SMART goal, meaning they must be specific, measurable, achievable, relevant, and time bound. This makes, when you ensure that the goals are SMART, it's more likely that the goals will be attainable for the client. Just some statistics. Three clients that have SMART goals and receive consistent encouragement and support are three times higher to make success likely compared to those who don't. 85% have improved confidence and 67 have reduced relapse. So, encouraging and supporting your client and working with them with the treatment plan and allowing them to be part of it is really crucial to your counseling skills and the counseling attributes. Reframing and redirection is basically helping the client see their situation from a different perspective. And it does not deny difficult realities, but also offers alternative interpretations that are equally valid and more helpful, which helps to shift their perspectives about how they see their circumstances without changing the circumstances themselves. For example, for a client that have depression, when a client says, "I'm a complete failure after not getting a job," reframe it to the client like, you prepared for and you attempted something challenging, which shows courage and effort. What can you learn from this experience? So Reframing and redirection is not just about positive thinking. It acknowledges difficulties while finding constructive interpretations that empower your client rather than Defeat them. It leads to cognitive shift, which will help them to um, which will help them get some emotional relief and new behavioral options, so that they can eventually generate helpful perspective without the counselor's assistance. If you're going to be constructive to a client, make sure you have a strong relationship first. Make sure trust and rapport is established. Make sure you use I statements in a curious tone rather than accusatory language or judgment. Make sure you focus on the specific contradictions between what the clients say they want and what they actually do. And always, please, if you have to be constructive, use compassion. Examine them to explore their contradictions together, but don't blame them. Don't like blame them. You don't want to do that. And it's okay to have self-disclosure, but when you self-disclose, make sure you share small relevant pieces of your own experience when it helps the client. Don't overtake the session and keep sharing your story. No, the client is there for therapy. You're not there for therapy. So if you are going to self disclose, make sure it's brief and useful and bring the focus back to the client. Okay, so when you're dealing with a student that have general anxiety disorder and they have to do a speech or a presentation, you can say one thing that helps me with my nervousness is arriving early so I can set up and make sure everything is working how it needs to work. That normalizes the anxiety with a practical strategy without turning the session into a discussion of the counselor's anxiety. So remember, when you self-disclose, make sure it benefits the client, make sure it's appropriate, and make sure it's relatable. Facilitating awareness of here and now shifts the session and shifts the client to what's happening right now in the session, physically, emotionally, and in the therapeutic relationship in that moment. They are able to help the client connect their immediate experience rather than stories about the past or the future. And it helps the clients to notice patterns and how they relate to you during the session. Something like, I notice you frequently apologizing when sharing feelings, or you seem hesitant to make eye contact when discussing your accomplishment. Those sessions also bring awareness because you're inviting the clients to notice their bodies, their emotions, and their thoughts during the conversations. Asking them questions like, what sensations are you aware of in your body as we talk about this, or what's happening for you right now? So when you help them connect their emotions to their physical experience, that helps them build awareness and their emotional triggers as it's occurring in that moment. Usually, it's important to explore their family origin patterns, and that's usually done at intake about their childhood relationship, current patterns, how their needs were expressed or not expressed as far as communication. Those questions reveal family patterns around their specific diagnosis and if it was models appropriate for the specific client. Not to mention at Intech, when you're speaking with the client or even sessions, like help them to or encourage them to identify their social support network, people that they can contact during a crisis. That's crucial because if they can make a list of contacts who can respond to them calmly and not get overwhelmed by their strong emotions and help them to feel accepted rather than struggling, this helps create a practical crisis plan. And this makes it more manageable for your client. In counseling, you must develop active listening, like we discussed earlier. And sometimes conflicts may arise, whether individual or group therapy. Take a moment to pause, listen, and express, use I feelings, and work together with the client to find a solution that addresses both sides. And also take into consideration what you do for one client, especially depending on their diagnosis, is not what you're going to do for all clients. Make sure it's individualized, make sure you are empathetic, and make sure you are respectful, and pay attention to your tone. Pay attention to the words that you are saying, because again, we do not want to blame them. We want to help build their confidence and a clear in a clear way that they can understand, and in a way that they and you can communicate. And always try to understand their perspective fully, because you don't want to issue with transference or counter transference to take place, which can also ultimately rupture the therapeutic relationship. Developing safety plans, crucial, because you help the client to identify personal signals that they're entering a crisis state. Also, you create a list of specific techniques, coping strategies that they can use independently when they notice these warning signs. And you give them a contact list of people and services that they can reach out to when self-help strategies aren't enough. So, in the support resources, include professionals, trusted family, friend members, and crisis lines with specific phone numbers. And then also an environmental safety plan. Create steps to make the physical environment safety, such as removing access to the means of what's going to cause them self harm, or identifying safe places to go, or arranging transportation to emergency services. When a client is depressed or they have suicidal thoughts, create a list of trusted adults to call if they have thoughts of self-harm, if they arise, with specific numbers programmed into their phone. Also, develop step-by-step instructions to help clients with PTSD or any trauma response to help them ground themselves during a flashback, like 5 things you can see, hold ice in your hand, says today's day out loud, call your support person if needed. Having this plan ready reduces panic when triggers occur. When providing telehealth or health sessions or distant counseling, always talk to your clients at intake and even at every at the start of each session about the for benefits of telehealth and the considerations. Always let them know that is the need for HIPAA compliant form, what happens if technology requirements or there's any potential disruption, emergency protocols for a distant situation. And telehealth do comes with some potential in building rapport or reading nonverbal cues. However, the benefits is it gives access to clients with mobility issues or those who are in remote areas, and you're able to see the clients in their natural environment, and it reduces stigma for some of them who may feel uncomfortable in traditional settings. And it's also convenient for, you know, continuity care when they are travel or there's illness or there's any emergency. Um, After you build rapport, you can assign homework because it helps to extend therapy beyond a session, and it allows clients to practice new skills in a real world setting, and it create lasting change through repetition. So for a client that has depression, ask them to write down 3 good things that happen each day, no matter how small, which will help them to direct their attention to positive experiences. Or or if you have a client with PTSD or anxiety, help them try a specific breathing technique once daily and record how if it affected their anxiety level on a scale of 1 to 10, which helps them to build their emotional management toolkit. And it helps give them data on which techniques works best for them. Exposure techniques are really good for clients that have general anxiety disorder or any type of phobia because it helps them to face their fears or thoughts or memories in a controlled step-by-step way. And you have to start the process with creating a ladder that ranks triggers from least to most distressing, then systematically work up from the bottom to the top. Always start with the easiest and gradually increase. And then after building the skills, the exposure becomes easier when they face the most challenging. Use safe and slow exposure to harmless triggers like certain sounds or location, and always maintain control of the environment for the client so that they can use the coping skills before, during, and after each exposure. Another type of treatment that you can use with your clients is cognitive restructuring, which helps them identify distorted thinking patterns and replace them with more realistic, helpful thoughts. The goal isn't positive thinking, but accurate thinking that acknowledges both challenges and resources. For an individual that is depressed, help shift the I never do anything right to I had a tough day, but I still managed to complete some tasks. This doesn't erase their previous accomplishments. This helps balance the perspective and counters the all or nothing thinking. With PTSD, transforms something terrible will happen if I make a mistake to I can handle making mistakes. Everyone does makes mistake, and it rarely leads to disaster. This reduces the catastrophic thinking and builds tolerance for uncertainty. So, cognitive reinstructions help them identify unhelpful thoughts, question their accuracy via examination, replace it with more balanced thoughts, and practice to reinforce new thought patterns. Relaxation training is progressive muscle movement where you're tensing and then releasing different muscles group to recognize and reduce physical tension. Is particularly helpful for clients who hold stress within their bodies. Deep breathing, slow controlled breathing, where you're using your diaphragm rather than shallow chest breathing, which activates the parasympathetic nervous system, which helps reduce anxiety. Guided imagery, visualizing peaceful scenes or successful outcome uses all of the senses, which helps clients redirect attention away from their stressors and create mental respite. Mindfulness skills teaches your client to pay attention to the present moment, to what's happening right now, rather than dwelling on the past or worrying about the future. It helps them to observe their thoughts and feelings without labeling them as good, bad, right, or wrong. And it watches their thoughts come and go without getting caught up in the content of it. And it gently brings their awareness back to the breath or sensations when their mind wanders. For depression, you can use the 5, 4, 3, 2, 1. 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can see or taste. That right there reconnects the client to the present moment instead of being lost in negative thoughts. Or 3 minute mindful breathing provides a brief, effective pause from worry, and it helps the clients to focus entirely on the motion of the breath entering and leaving the body, and helping them to acknowledge when their thoughts arise and gently return focus to breathing. Problem solving training helps the client to define their problem, generate solutions to their problem, and evaluate their options and the way they want to choose and implement the action steps and to review the results. So, when you are asking them to complete something overwhelming into manageable chunks, you're teaching them how to, for the first for the first time, for the first minute, gather the materials for the first 5 minutes. Next, write the first thing that you're thinking in 15 minutes, take a short breath, break, and then continue. That creates a sense of accomplishment and reduces avoidance. And it also helps them have a systematic approach. Assertive training helps the client express their needs, their feelings, and boundaries while still respecting other. It's the middle ground between passive, not speaking up, and aggressive, demanding or attacking communication. This balance creates healthier relationship because you're teaching the client how to be honest about their needs while maintaining connection with other people. This is where you use I statements. You teach them to use I statements. You teach them how to use specific requests rather than complaints. You teach them how to be confident, but use a calm tone of voice and give them appropriate eye contact and body language. And you teach them how to respect others' rights to say no and setting and maintaining personal boundaries. I know this lesson was really long, but I really wanted you to get the sense of this part of the exam, which is the counseling skills and the attributes. The link for the flashcards will be in the description if you need tutoring or if you need support. The link is also in the descriptions. Remember, I'm here to support you. This time we're going to pass with a purpose. I hope this presentation is helpful to you. If you have any questions, put them in a comment, like and subscribe. If you haven't done so already, go ahead and check out my clinical method, a narrative practice that I've been using and showing and teaching you how to attack narratives like a clinician's, so that way you can be set up when you read to take away your nervousness to be comfortable. See you next video.